Hi, and welcome to the School Health Educators Podcast, where we discuss health education and how to best teach health ed in the K 12 setting. Hi, and welcome to the School Health Educators Podcast. I'm your host, Lori Reichel, and today we're going to go over some more resources that my guest, Debbie Yelle, likes to refer to when she's looking for updated information on specific health content, or she's actually introducing it to her students in her middle school. Before I continue, I'd like Debbie to say hi. So this is episode number 2. Debbie was on the last episode to go over some things. Debbie, thank you so much for being back and going over new resources or these other ones. Would you mind saying hi to our listeners and reminding us a little bit about yourself?
Hello, thank you. And thank you for having me back. And thank you for repeat followers or viewers. So just kind of a refresher who I am is I currently teach health at a middle school. I've taught in both Wisconsin, Minnesota, and Illinois. And every environment has been a little bit different. And then one of the resources I'm going to touch on is often as a health teacher, we are put on committees or we are sought after for advice on either the social emotional standards, the district wellness committee, or other initiatives that might happen in the building. Could be that you're on a truancy task force, a discipline task force. But just I've had some great experiences of working with some teen moms, writing a kinesiology class, working on a community. And when I was in White Bear Lake, just on a side note to this, is when I was in White Bear Lake, they were revamping the towns, the White Bear Lakes community wellness initiatives, which the school was just a piece of that. So, I was next to a clergy person, I was next to a community doctor, just fabulous. So, one of the resources I'm going to talk about can more help you if you're a health teacher in the capacity of health, but not necessarily it's not teaching content you're looking for.
I love that because one of the courses I actually have been teaching at SUNY Cortland refers to school health programs. And we
Yes,
talk about coordinated systems, which we now refer to as the WISC model, the whole school, whole community, whole child,
yes,
because it's
yes.
not just us in the health classroom, yet it's more in which sometimes you're hired as a health education teacher, yet you're asked, we're kind of told, you're also
Right,
going to do this for us because you represent this, which is
right.
wonderful.
And I would say if there was any teacher, and that is being asked to be on one of these committees, when I reflect back on my career where I learned some of the content that and not even content, but maybe approaches, different ways of thinking, is through those initiatives that I was a part of, those opportunities that were outside of the classroom, the workshop that I went to, or the person I sat next to. They're valuable experiences.
Yes. Well, let's jump to the first resource. Yet
Okay.
before that, this is a reminder that when you go to a resource, make sure that it's updated. One of our standards in school health education is accessing valid information. So make sure that the publication is updated. It's written by someone who really knows what they're talking about, that they're an authority on that subject. And that it's not some kind of like a selling of a product or something like that. Just make sure the resource is valid, reliable, accessible, and age appropriate depending upon if you're using it with
Mhm.
students.
Correct.
So I'm going to start
Absolutely.
sharing my screen too for those of you that want to watch this on the YouTube channel. And the first one that we're going to talk about in this episode is Kids Health.
Yes.
I
Okay.
know Jessica Butts talked about a couple of weeks ago on another episode. She does refer to this resource a lot. So, what is this resource about and how do you use it, Debbie?
Well, I think there's a couple ways that you could use it. One, if you had a family member that was, or excuse me, not a family member, but if you had a parent that was asking you for resources, they have a tab that you can look on, and you could refer a family member to that. They also have the other thing that I like is they have it broken up into kids and teens. So again, depending on the age group that you're going to use it with, you could just have where students explore this. You could build it in where I'm giving you this website, you have 15 minutes or 30 minutes and you're going to explore and you're going to fill out a worksheet. It could be something like that. I use it for a specific reason, but there's that option. There is the educator thing. I don't know if this part is as extensive as maybe I had hoped it was going to be. Currently there's like one thing that I use off of here. But it's really more the other part of the website that I'm using.
And
So
I
if
think
you,
this is a common one that we use in the field. A lot of people know it. I'm sorry, did you want me to go to a certain page?
well, I just gotta say, I talked a little bit about it in episode 1, where in our 7th grade unit, we have students first learn about some body systems, and then we kind of do this overview of drug education, and then we have them do like they combined those two knowledges, right, where they pick up a drug that they have to cover. And so we have them actually use one of the services here, the resource link, as searching for drugs. So go ahead to 14s, click on 14s again, if you wouldn't mind. Thank you. And then hit up where it says drugs and alcohol. And so again, this is another place that we have students go to. But the link that I have, I'm not sure how we're going to get there right now, but it's a link that has all of the drugs listed.
I will say I wish they would update some of the phraseology on the website because
Yeah,
alcohol is one of the most abused drugs. So I would put drugs, including alcohol.
yeah,
That's
yeah.
something it's one of my pet peeves in the field. Yet I did pull up, like when I clicked on the word drugs, a variety of drugs did appear. Is that what you were
Yes.
looking for?
Well, no, I have a link somewhere that's related back to this site that is just lists all of the drugs in a row. And so that's the one that I have that's the link that I give students to. I more define where they're going to go when they get to a website. So that again, I give students the National Institute on Drug Abuse, and then I give them this link, and then I give them a specific task in which they're going to do, and they have 2 different resources that they can use.
Wonderful.
Yeah.
Okay, so this was one resource, that's Kids Health. Another one is one, I'm not sure if I say it correctly. It's Olweus Bullying
Olweus, yes.
Prevention.
So Dan Olweus is a leading researcher and educator from Norway, and he was part of the initiative in Norway. At least this is my understanding. He was part of the initiative in Norway to come up with a bully prevention program, and then it kind of expanded here to the U.S. And when we were trying to define the definition of bullying, Dan Olweus was on one of those national committees. And now move forward, I'm in a district. There was some litigation that happened, and part of the agreement was the district that I was in, not the current district, but a previous district I was in, is that they would find a K-12 bully prevention program that was reliable, that had a K-12 focus, that had some teaching components to it, and they ended up using Olweus. And Olweus then has a partnership with Clemson. They also have some sister programs with like Search Institute. So some really good other, like connections, right? Clemson education program, and then you've got Search Institute and working together with Olweus. But in the district that I was in, they provided training on how we were going to create a framework in our district for bullying prevention that could be delivered within the classroom, as well as how schools could approach it in other areas other than in the classroom. So recess, playground, locker rooms, bathrooms, on the bus. But one of the things, so again, if you are a health teacher and you are being asked to be on an initiative on the wellness or on an anti-bullying thing, this is a program that I think you should take a look at on how it creates a framework.
One thing I note on their site is that they're using the word bully as a verb. We don't title a child as the noun bully. So the terminology in here seems to me very updated, and they also break down what the difference is between verbal bullying, physical bullying, relational aggression, which we need to talk
Yes.
about, and then cyberbullying. I will say one thing for me that I always have a challenge with is that word teasing. Depending upon teasing, for a lot of people can be something that helps us connect, yet you have to know your audience. If you're
Mhm.
the intent behind what you're doing is to have somebody have a negative reaction, embarrass them, make them cry, then that goes into the bullying definition. And so for me, I typically go over, even with the college students who are going to be teaching in the K through 12 setting, I talk about, for me, there's a difference between joking, teasing, and bullying. Make
Mhm.
sure you
Mhm.
go over that with your students.
Yes. So one of the things that I really liked about this from the teaching standpoint, if you do bring it into your district and you do the training, is it's kind of this naming. So we're going to name what teasing in is. We're going to name what verbal bullying is. So I really liked that. The other thing that I liked is that in a lot of programs, I haven't necessarily seen this, is they have white papers that connect back to some of their positions. So, there's one part in the training where we talk about is there a connection between suicide and bullying? And what I liked is that Olweus has some of the white papers, so they actually make those available where you can read some of the data. And I just thought that was very good. If you come way over to the right, where you'll see, I don't even know, Yas Go, that is an interactive game format about bully prevention game that could be used at the elementary level. And it's my understanding, because I did just in my preparation for talking today, is I did call Clemson, the person that's in the department, and wanted to know about a lesson that I'm going to explain, and then this. So Yas Go is, you don't have to be part of the Olweus program and have the facilitators and all of that. You can go ahead and just purchase this piece if you're looking to add this into your school.
Wonderful.
Um,
Wonderful.
One other thing I just wanted to add that again is an example of different experiences of or committees or activities you might be on, and then you get this aha moment. It was actually working with Olweus at a school when I really had this understanding. One of their activities is where you do a half circle and somebody is being bullied, and um, students are kind of role playing this, but the person that is actually being bullied should be a stuffed animal so that no student is feeling bad. But it was this idea of understanding that out of the circle, you really had somebody that was bullying and somebody that was maybe, so somebody that it was somebody who chose to bully. And then there was this person that was, like, if we wanted to call that person that is being a victim. And then you have all these kids that are standing around, which now we've kind of turned, named that as bystanders. And what I loved is this understanding of, because kids are in a half circle, that's just how we have visually did the activity, is this understanding of how do you help a kid just move over one place, because it's not the easiest to tell a kid, well, you're just standing there and you've not done anything, and you need to become an upstander. I mean, that's a skill and it takes courage. And so how can you move over one or two spots in this continuum of that you were a bystander that did nothing to seeking help or saying help or getting help, or saying something in the moment. So that was an aha moment for me of, as a health teacher, is just this understanding of we need to teach kids how to be up standards.
Wonderful. Okay, the last resource we're going to talk about today is Health Smart Virginia. So it's healthsmartva.org. And I've noted this in the past that there's a lot of lessons on here. And I will have to remind people, if you're listening in, remember, if you're using somebody else's lessons, please give them credit. I know some people think they invented stuff, but things have been out there for a long time. Please be collaborative and provide credit, in which I believe there's a lot of resources on the Health Smart Virginia resource site. Would you
Yes,
mind
and one of the
sharing your thoughts about it?
well, one of the things that I liked is that I think again, because time is, there's only a certain amount of time, especially if you're teaching multiple grade levels and you have other responsibilities, maybe as a teacher. So I like this, that you can quickly plug in a grade level, you can plug in a topic. For the most part, you can quickly kind of go down the search and look for topics that might be interesting within the topic. So this is how I use it. I teach sixth, seventh, and eighth grade. I would probably hit 6, 7, and 8 if I was looking for something, right? So I'm thinking about the current units of study that I'm teaching. I'm thinking about where do I need to improve on resources for myself or for that I'm going to have students interact in. Maybe something that for the last couple times I taught it, it hasn't gone well. So then let's just say that it's going to be under it. That's fine. Let's go under mental health. So I'm going to click that. I'm going to click search. And then boom, I got 121 things that I can kind of look through. And I just think that it is an efficient way to go about looking for a resource that has been vetted, which I think is nice.
Wonderful. And I know that the topics on top, they're the common health education topics we refer to. There are lessons within this site that
Right.
are skill based. So when you look at the other standards, not just functional health knowledge, but the other standards of 2 through 8 of the national standards, there are some items that people can refer to on this site.
Yes, yes. And just to piggyback on a comment that you said earlier is like, give other people shout outs, and then rightfully so if you get if you get a resource from someplace that you need to keep that. I mean, I'm guilty as is when I used to get resources, like if there were things down in that, like in a PowerPoint down in that notes page, I used to like delete it because for some reason I used to find that all stuff was like distracting. And now when I'm looking back at a resource and if it's touched too many hands, then it's just morphed into something else. And sometimes when we're health teachers and we come into a district, we're kind of given PowerPoints or given Google Slides as our curriculum. And what we don't really know is this really the fifth version of the person that I'm replacing, or is this the actual version that came from the curriculum that I was given? And so I've started now, even when I might mix a couple PowerPoints together and kind of make it myself, is I've started to like footnote each slide where it came from, or I'm linking the website back to that so that if I need to go back and update myself, or I just think it needs to be a practice in our profession.
I agree with you 100% because we're working as a team. That's the whole purpose behind this podcast, as well as the School Health Educators website. I want it to be a collaboration. This isn't Lori Reichel saving the world or Debbie Yelle saving the world. It's us working together to do the best we can with the tools we have, and then to provide the tools for children and youth so they can
Right.
have the happiest and healthiest life they can. So this concludes this episode, and I thank you so much, Debbie, for being here today. As an overview, Debbie and I discussed a little bit about Kids Health, the Olweus Bullying Prevention Program, and then the Health Smart Virginia resources available on that site. And I'll attempt to have those links in today's description for the episode. Yeah, Debbie, would you like to say anything before we end for today, as well as tell us how people can get in touch with you?
Well, wonderful. Well, thank you so much for having me on. And I would just encourage any health teacher out there to collaborate with the health teachers in your building, collaborate with, your cross district people. And if you are a singleton, then you start looking to see who's teaching health in other districts, get on their websites, go meet for coffee. Just make sure that you're not teaching in isolation. It can be overwhelming, and it also can be, frightening, especially if you're starting out new in the profession of like, how am I going to fill this time with all these kids? Um, how people could get a hold of me is by Debbie.Yelle at d303.org, or yell positive living at gmail.com. I also have an Instagram at Yell Positive Living, and I also have a TikTok under Debbie Yelle. So just a variety of ways that people can get a hold of me if they're interested in, continuing to have a conversation.
Wonderful. Thank you again so much, Debbie, for your time for this episode as well as the past one. I really appreciate your wisdom and your experience of using a variety of resources. It's so important to make sure that you go to a resource that is valid, updated, accessible, etc.
Absolutely.
So, for our listeners, I thank you so much for listening in. Please remember to follow this podcast on your favorite podcast platform. And it would be great to get a 5-star rating. Thank you. Thank you. Also, check the School Health Educators website. So it's at schoolhealtheducators.org or .com. And last but never least is my comment of remember, you make a difference. You matter. And thank you so much for what you do for children and youth. Thank you again for listening in and stay well, folks.